Let's talk now to Jane Townson, who's the Chief Executive of the Homecare Association. Jane, good morning to you. How's this deadline going to affect your staffing numbers?
Well, first of all, it's very important for us to stress that we have always strongly favoured vaccination because there is clear evidence that it protects against serious illness and death. But at the moment, as it stands, we've got almost 18% of home care staff without having both vaccines, which is required for the regulations. If that doesn't change between now and the 1st of April, we stand to lose maybe somewhere between 75,000 and 100,000 care workers. There are roughly one care worker for every one person receiving care. So that's an awful lot of people that could potentially go without care.
When you say 75,000 to 100,000, out of how many?
500,000 roughly.
So a fifth of your staff could be lost?
Yes. If we don't get significant progress between now.
And so what will help reduce that number that could be lost between now and actually it's the 1st of Feb, isn't it? Because that's when the first vaccination will have to be taken.
Yeah, the number that have had a first dose is a bit higher. So we're up to 88% of staff that have had the first dose, but it's still over 10% that haven't. And 10% of a large number is still a big impact.
So if you lose 50,000, and you were just saying that care at the moment is 1-to-1, so one home carer per person, per someone who's needing care, that reduces it to what? How does that practically change the care that someone would receive at home?
So already we're seeing the impact of workforce shortages. We're seeing councils saying they can't supply care to people that need it. We're seeing hospitals unable to discharge people in a timely manner. We're seeing hospitals having to offer financial inducements to families to come and collect their loved ones from hospital. We're seeing opening of care hotels, which are a temporary solution to trying to address the problem. What we're really concerned about is the impact on older and disabled people of loss of care, because many people have no one to look after them. They are unable to get out of bed themselves. They're unable to feed themselves. What's going to happen to those people? Who's going to care for them? And in some parts of the country, particularly London, where only 50% of staff have received vaccination. So we could lose half of the workforce in some places.
What you are talking about is very real and it will affect people, and that is frightening, obviously, and no one wants to see that. At this point in time, and I know you said you're not anti-vaccination at all, you're pro-vaccination but just not pro-mandatory vaccination. At this moment in time, if 10-12% of your staff, of care home workers, or of home workers I should say, home care workers, haven't been vaccinated, what's going to persuade them to now?
Well, many of them have got genuine fears, and what we found is that when they have the opportunity to sit down one-to-one with a trusted clinician, preferably someone from the same community that they're from, really listen and help to address those fears, many of them do go on to have vaccination. So we've been pushing both NHS England and the Department of Health and Social Care to provide some funding for that time for clinicians to spend with care workers. Up to now, nearly all of the effort has gone into care homes for understandable reasons, because the risks in congregate settings are much higher. And I think that's another point we want to make, that even in the first wave of the pandemic, when we didn't have enough PPE, we didn't have routine asymptomatic testing for home care, and vaccines had not yet been developed. The number of people that died from COVID in home care was very, very low compared with care homes, and has generally tracked the wider population. And if the government's really concerned about the welfare and the safety of older and disabled people, they need to control community transmission. And at the moment, they're removing masks, telling people they can't, they're not going to pay for tests, that they might even bring forward regulations that require self-isolation if you're COVID positive. So while they're encouraging spread of COVID in the community, everybody else is expected to keep older and vulnerable people safe. And the two things are just not consistent.
Jane Townson, CEO of the Homecare Association, thank you very much for your time with us this morning on Breakfast.